Edition, a clinical trial by the Singapore Eye Research Institute and Singapore Chunghua Medical Institution has yielded positive results. Now, it found that the traditional Chinese medicine method of acupuncture is effective in treating patients with dry eye.
So this was the result of a 3-year study involving 150 patients, and Cheryl Goh has more, but we would also like to, warn some of viewers that you may find some of the following pictures, a little bit disturbing.
Imagine having to lie still for a good 20 minutes while not one, not two, but over 10 needles are poked into various points around your eyes and face. It's not for the faint-hearted, but for 54-year-old Madam Tan Hua Moi, the ant bite-like sensations are worth the results, which in this case are tears. Now, patients like Madam Tan here were among the 88% of patients who saw improvements to their dry eye condition after undergoing treatment using both acupuncture and eye drops. Now, this includes reduced redness and itchiness, as well as higher tear production. As a participant of the study, Madam Tan went through 8 sessions of acupuncture, combined with using artificial tears or eye drops.
After the acupuncture on the 6th time, I'll find that it's good because I have natural tears to make my eyes more moisturized. So then I will find that right now I don't need to use any eye drop already.
Doctors say dry eye is common among middle-aged adults, with at least 1 in 3 suffering from the condition. This lack of tears could result in visual disturbances, irritation, and even higher risk of eye infections.
Dry eye is basically a disease of modern living because more and more people are having less and less sleep, more and more exposure to air-conditioned room, office work, as well as air conditioning. So these things tend to computer use as well.
Besides acupuncture, 80% of patients who were treated with a mix of herbal medicine and eye drops saw an improvement in their dry eye symptoms. This is compared to 72% who saw improvements using just eye drops alone.
The important thing is that with an alternative treatment for dry eye in this way, you get less stress on the existing resources, and so patients have an additional alternative before they try more invasive therapies or more expensive therapies.
Prof. Tong hopes more patients will embrace this traditional method to treat a modern-day problem.